1 in 6 men in the U.S. will be diagnosed with prostate cancer in their lifetime, but due to the PSA and other tests, exams, and procedures, it's estimated that almost half of prostate cancers are found at an early stage. Some of these early stage cancers grow so slowly that it takes years before they become a health issue. But each year, tens of thousands of men with low-grade, low-risk, localized, and clinically insignificant prostate cancer rush into various treatments. Many thousands of these men are left suffering from side effects and medical complications that can seriously impair a man's quality of life. Men are sometimes not familiar with an alternative where treatment and its complications and side effects can be safely postponed, often for years, with careful monitoring. This alternative was previously called watchful waiting, but now, with more rigorous monitoring and testing, it's called active surveillance. Scientific studies show that active surveillance is a safe and non-invasive approach for low-grade cancer, and it's become a widely accepted standard of care at cancer centers throughout the U.S. During active surveillance, doctors provide vigilant testing and monitoring, and if and when the cancer is reclassified at a higher risk, a treatment can be started. If you're considering your options, you can learn from 3 active surveillance patients who will share their experiences. Jim has been on active surveillance for 4 years. Carlos followed active surveillance for nearly 5 years before starting hormone therapy. Jerry has been on active surveillance for 13 years. But first, it's useful to learn what prostate cancer experts are reporting about active surveillance. In a study led by urologist Lawrence Klotz at the Sunnybrook Health Sciences Center, affiliated with the University of Toronto, 452 men were enrolled in an active surveillance study with a median follow-up of 7.2 years. PSA testing was done every 3 months with periodic biopsies and other tests and measures. 30% of patients were reclassified at a higher risk and offered treatment, while 70% did not require treatment. In another study, Peter Carroll reports that 658 men were enrolled in an active surveillance program with a median follow-up of 4 years. PSA tests were done every 3 months and a biopsy every 1 to 2 years along with other tests and measures. 36% of patients received treatment within 5 years after diagnosis, and 64% remained clinically well and not in need of treatment. Dr. James Moeller from the National Comprehensive Cancer Network, a group of 21 major hospital cancer centers throughout the U.S., stated that growing evidence suggests that overtreatment of prostate cancer commits too many men to side effects that outweigh a very small risk of prostate cancer death. These cancer centers now recommend active surveillance as the initial treatment for men with low risk and very low risk prostate cancer. Active surveillance is also defined as actively monitoring the course of disease, with the expectation to intervene if the cancer progresses. Mark Scholes is a medical oncologist and an associate clinical professor at the University of Southern California School of Medicine. Dr. Scholes has written and lectured about active surveillance, and he treats many patients who follow a program of active surveillance.
Well, most people are familiar with PSA, a blood test that measures how much cancer is present in an indirect fashion, and we like the PSA to be less than 10. We also are more comfortable if the PSA has been stable for a period of time and not rising on a consistent fashion. A third thing about PSA, we can look at a relationship between how big the prostate gland is and how much PSA is present. Men with big prostate glands are allowed a higher PSA. Men with smaller prostate glands are expected to have a lower PSA. So all these factors are taken into account just with PSA testing. Then we look at the needle biopsy that men have and how much disease is present. Is it just simply one core of one needle core that has cancer, or is it 5 or 10 cores? Obviously, the man that has just 1 or 2 cores is a much better candidate. And then lastly, we look at the grade of the cancer, how angry the cancer looks under the microscope. And there's a system of 1 to 10 that's used, and it turns out that anything graded 6 or below is low grade. 7 is in between, 8 to 10 is high grade. So all men that have 6 or below, men who have less than 2 or 3 cores involved and who have PSAs less than 10 are potential candidates for active surveillance. The newly diagnosed patients that we see in this practice, I would estimate that about a third of men that we see these days are offered active surveillance as an option for their treatment initially. The risks of active surveillance are, first and foremost, I think, that you might have an inferior quality of life. People who have surgery or radiation that don't get all the side effects can put this disease behind them and move on and not think about prostate cancer. Whereas men on active surveillance, they're still in the mix constantly. They're seeing their doctor, getting PSA testing, and the anxiety that that may engender is probably the risk associated with active surveillance. The risks I just described are a far smaller burden than the risks of having surgery or radiation. Even if you have surgery or radiation, you still experience some uncertainty as whether you're cured or not, of course. So it's not completely get out of jail free card. But the risk that you pointed out, which is what's on everyone's mind, is, well, what's the chance that the cancer will grow or escape, and where I could lose a chance for being cured, whereas if I'd treated the disease immediately, I would have a good chance for being cured. And the studies that have been done in that regard suggest that the chances of that happening are quite small. There's a common mistake that is made by patients and doctors alike is to look at statistics and say, well, the statistics say this is 90% this won't happen. That means it won't happen. Well, that's a big difference between 90% and 100%, because you don't know who's going to turn out to be in the 10%. So when people are looking at all their options, just because something's likely to happen doesn't mean it's certain to happen. So we counsel patients to try and put themselves in the shoes of the what-ifs. Consider, even if you were unlucky and had to live with this thing that's not supposed to happen, but what if it does happen? Can you live with that? Because it could happen. It's an unfortunate thing that most people aren't that sophisticated with statistics. If they were, they wouldn't go to Vegas. I mean, you're guaranteed to lose ultimately in Vegas, but people go for the fun of it. But this is a much bigger stakes decision, because usually it's just one decision, one bet. And you put all the chips on the table, and you win big or you lose big. And just because something's not likely to happen doesn't mean it won't happen. And then you're living the rest of your life with that unfortunate, bad outcome that shouldn't have happened. People have to inject their own priorities. Some people have a very active sex life, as we've talked about before. And the thought of losing it would be a devastating impact on their quality of life. Other people, it might be a lower priority. Some people are older, some are younger. So there's all kinds of different factors for the clients. We're trying to emphasize with newly diagnosed patients is that you need to prioritize quality of life. Since this particular illness, prostate cancer, tends to have such low mortality rates, men are almost guaranteed to be living with this for years and years and years. So if men are projected to live another 15 years, and they have a good quality 15 years, that's a victory. So these are some of the most valuable years of a person's life, and the quality of life perspective is what we try and emphasize.
To summarize, eligibility criteria for active surveillance are well established. Risks include anxiety that varies with each person and the chance of disease progression. However, with treatment, urinary, sexual, and other complications occur often. Consider the specific risks of each treatment compared to the risks of active surveillance before making a choice. Patients Jim, Carlos, and Jerry describe their experiences with active surveillance. The complete DVD for this program is available on Amazon.